Well, we've just had a very important debate on asking the profession to completely oppose the bill, which was narrowly lost, but it was very narrow. There was a lot of concern in the room, and as a GP myself, we're involved in clinician-led commissioning. It's working really well. You know, we're making big changes, but there's no need for any legislation. We don't need a bill because we're doing it well in my area. PCTs are disappearing, the levels of bureaucracy are going down. So I don't see any need for a bill.
I feel it's unlikely that the government is going to listen to a call from us to outrightly reject the bill. And as many people in the debate pointed out, there are a number of things that we do actually want in the bill. Although we accept that the way the bill has been amended, it's not the most coherent of pieces of legislation that we've ever seen. But I think it's something that we can work with. We have been working with the government. We have been pushing them to make changes. They've made a lot of changes, and I think it harms our credibility if we get the changes we ask for and then say, oh no, we're taking our ball home.
I have always felt that the golden age of general practice was during fund holding, which I know I'm not allowed to say in a lot of circles, and I think that there's a lot of very excited GPs who are really looking forward to commissioning, and I feel they should be given the chance to do so.
Our point really is that the bill is all of a piece. It's a whole thing. It's not something that we think you can take little bits out of, and even any little good bits you might think are totally eclipsed by the huge and awful dangers inherent in this bill. This is it is a crossroads for the NHS, and we do believe that if this bill is passed, especially the competition elements, that it's going to be irreversible, because once you get private companies in, you can't get them out again.
I think interestingly we had a debate just before which included the withdrawal of the bill, asking for the withdrawal in its entirety, provided other caveats weren't met. And actually I think there was some very sensible points made during the debate about the removal of primary health care trusts and so on, which really, if we do reject this bill, as was mentioned, we are essentially saying we don't want the reform which we've been calling for years really.